Yes friends, I have brought a video for you where I'm going to give description about 35 most common role play topics in OET speaking. Hi, I'm Dr. Arshnu from Dr. Arshnu's OET Institute, and it's my request, if you have not subscribed my channel yet, subscribe it right now, and also share my videos with your friends and colleagues so that they too should be benefited from these. Now let's start the video. I have categorized these 35 topics into 6 major parts, and these are: first is patient education and advice, second is providing emotional support, third is dealing with complaints or concerns, fourth is home care guidance, fifth is emergency situations, and sixth one is routine checks and follow-ups. Now I'm going to explain these all in detail. First is patient education and advice, and this is the most common topic in case of both nurses and doctors in the exam. And I have again given 10 subtopics in this part. First is explaining medication, side effects, and proper uses of the medicine. So this can be in the OPD, hospital discharge slip, and community center, where a patient is being checked and after that he is explained about the medication and the side effects of this. Second is advising on lifestyle changes for diabetes management, hypertension, high cholesterol, obesity, or any of these topics. Here we advise the patient to adopt a lifestyle where he can control these problems without taking any medication, or if the medication is prescribed to by the doctor. Third is educating a patient about post-surgery wound care. After the surgery, when the patient is being discharged, at that time he is educated regarding medicine to be taken or the wound care, dressing if it is to be used, keeping the dressing dry and clean. So this type of the management is told to the patient and he has to do this. Fourth one is guiding a patient on how to take care of himself, and if it is in the case of the young one, in that case the parents are guided to take care of their child with a fever or any other condition, and this condition can be if an elderly patient is in the care and his children can be guided regarding this. Next one is teaching a patient how to use an inhaler for asthma. As asthma is also a common topic here, it could be the management of asthma or explaining about the uses of inhaler. Then explaining the importance of physiotherapy after stroke. Physiotherapy could be in any form. It could be in the hip replacement after the fracture, or if it is required in the case of stroke, chest infection, or anywhere. Then counseling a patient on weight management and diet. This is also important topic when the nurse or doctor has to advise the patient to reduce weight and to adopt a certain type of diet modifications. Then advising a smoker on nicotine replacement therapy, especially to advise the patient to quit smoking and the different type of the procedures to be adopted to do this. Ninth one is explaining the need for vaccination and its side effects. A patient how to monitor blood pressure at home. So this is in the home care. Now the second major part, that is providing emotional support. Again, here the subtopics could be reassuring a patient who is nervous about an upcoming surgery, pre-operative procedure to be explained to the patient, and the instructions which are followed before the surgery. Like he has to stay empty stomach, and secondly, stay in the hospital without taking any type of liquid even for 3 to 4 hours, and taking any type of the solid for 7 to 10 hours. Then comforting a patient diagnosed with a chronic illness, for example, arthritis, or it can be any other illness which needs to be monitored and which needs a proper or long-term medicine. Next is supporting a patient with anxiety about hospital discharge. Then 14th one is encouraging a patient struggling with depression and loneliness. 15th one is assisting a family member coping with the terminally ill patient, especially in the case of cancer. So the support which needs to be given to the patient by the family members, and you being a doctor or a nurse giving this support to the family members, how to cope with this position at this condition. Then dealing with complaints or concerns. This is a third major part in this series. This is addressing a patient's concern about delays in the treatment. Suppose a patient is waiting in the waiting area in the OPD or the emergency, and you have to convince the patient why the treatment is delayed. It might be the doctor was busy or there was some emergency in the hospital. So that's the reason patient needs to stay calm and wait in the waiting area. Next one is explaining the reason for a hospital policy, for example, visiting hours or certain type of the diet to be followed in the hospital, or the reason for staying in the hospital for a long time. Then handling a patient's complaint about side effects of medication. This is if the patient is complaining about the side effect of any medication, so you have to convince him regarding this. Next is assuring a patient who feels their symptoms are not taken seriously. Again, this is a topic where a nurse or doctor has to convince a patient that he is an important person and the doctor is or the nurse is really serious about or concerned about his treatment. Again, convincing topic. Then the next one is explaining why a particular test or procedure is necessary. We may talk about any type of the test which is required. Suppose it is MRI after the CT scan or MRI in case of head injury or accident or any other disease condition where any type of the test that is required. Fourth one is the major fourth topic, that is home care guidance. It's especially in the case of the nurses where teaching a caregiver how to assist a patient with mobility issues. Or it could be giving certain type of medicines, then physiotherapy or food, how it is to be given to the patient. Then the next one is providing guidance on caring a patient with dementia, especially in the case of the elderly patients. When a caregiver is giving care to the or taking care of an elderly patient or parents, so how to deal with dementia, because they have a problem or of forgetfulness or memory loss. So the patient has to be very calm. The caregiver has to be very calm and peacefully handle this condition. Then the next one is explaining catheter care to a parent of the child or patient or their family member, might be his daughter, son, to take care of the parent catheter, especially cleanliness, maintaining hygiene. Then the next one is educating a patient on managing a colostomy bag. Then the next one is guiding a family on home care for a patient with bed sores. These are again the critical care topics where elderly patient or the patient who is suffering from long-term illness, especially in the case of stroke or fracture, how to take care of bed sores. And then the previous topic was colostomy bag. Now fifth one is emergency situations, explaining what to do in the case of hypoglycemic episode, advising on first aid for minor burns or wounds. This is in the case of the children. The parent come to you and we have to explain them that certain type of injuries are common in case of the children and how the parents have to take care of their like burns or any other wounds. Then the next one is explaining symptoms that require immediate medical attention after discharge. Suppose a patient underwent some surgery and the caregiver have to take care of the patient in case of severe pain or fever or any abnormal symptom he observes, skin coloration, discoloration, if the skin turns red, black, so he has to inform about this to the emergency department or to the doctor. Then the sixth one and the last one here in this series is routine checks and follow-ups. Here the topic could be conducting a preoperative checklist discussion with the parent of the child or directly patient or any caretaker. Next one is providing follow-up advice after a vaccination or minor surgery. Then advising a patient on the importance of routine checkups or chronic diseases. I have added one more stream here, that is health promotion and preventions. Here I have taken 4 topics. These are discussing the importance of hydration and a balanced diet, then encouraging a patient to engage in a regular physical activity, then explaining the need for regular cervical smears or mammographs. It's especially in the case of the females, so pap smear test and mammographs to be taken if they are suspected for any type of the body changes. Then educating a patient on infection control measures, for example hand hygiene or other type of the hygiene, particularly surgicide hygiene, or if the patient is having any type of the infection, how he has to control it. So these type of the topics can be commonly asked in the role plays in the exam. And now how you have to prepare these topics? Focus on the criteria of the role plays, that is empathy, clarity and reassurance in your communications. Then I have given in one of the videos that ISBAR formula. It is introduction. First of all, you have to introduce yourself, then asking about the situation. This is information gathering. Then the background of the patient, if the patient has any family history of that, then examination or assessment, and then last one is information giving, advice giving or recommendations. The last tip is practice listening and paraphrase a patient's concern to show understanding. You have to listen to OET podcast as much as you can. This will not only improve your listening skills but also your speaking skills. Hope this video will help you to get good score in your OET speaking. Wish you all the best. See you very soon with a new video. Stay connected, happy learning, and must share this video with your friends and colleagues. And if you like the video, so must like it. Thank you so much. Subscribe my channel.